everyone, it's Dr Mirza here again. So today we're going to be doing an implant on tooth number 3. She'd fractured the tooth about 6 months ago, so we extracted it, we placed a bone graft. She's actually just flying in to get the implant done today. And then she'll be jetting back out again, so we're going to get that taken care of for her today. So we're going to go over to the implant case that we're going to be taking care of today. If you can have a look here, tooth number 3 would go here. It's the top right molar. This is tooth number 2, another molar, and this is the premolar. The slight thing that we have to worry about with this is that she has a very low sinus. So right here is a sinus. Sinus is sort of like an air pocket right up inside her jaw over here. So when we place the implant, we have to try and avoid that so the implant doesn't go there. So that's going to be kind of like a little tricky thing that we're going to have to work.